A very good afternoon. It's me, Ramesh Bhandari. Today, I am here to discuss on a topic of Hanta virus. First, we'll see what is Hanta virus. The Hanta virus, these are the RNA negative sense envelope virus, which generally causes an infections when in rodents, but occasionally they causes infections on a human beings. The hantavirus in an Americas, they are known as a New World hantavirus, and the infections which is caused by a New World hantavirus, it is known as a hantavirus pulmonary syndromes. While that, in case of Europe and in Asian countries, this hantavirus is known as a Old World hantavirus, and the disease which is caused by the Old World hantavirus, it is known as a hemorrhagic fevers with the renal syndromes. There are different strains of hantavirus. There are the different strains of hantavirus, which they are based on the geographical distributions. There are the different strains of hantavirus. The first strains of hantavirus, it is a sin nombre virus, which is generally found in an American countries and causes a disease known as a hantavirus pulmonary syndrome. The second strains of hantavirus, it is a Hantan virus, which is generally found in an Eastern Asian countries, particularly in China, Russia, and Korea. The third strains of hantavirus, it is a Brava virus, Brava virus, which is generally found in Balkans. The fourth strains of hantavirus, it is a Sarima virus, which is generally found in a Central European and Scandinavia. The fifth strains of hantavirus, it is a Sol virus, which is generally found all over the world. And the sixth strains of hantavirus, which is causing a human infections, it is known as the Fumala virus, which is generally found in Eastern European countries and in Western Russia. If you talk how the people become infected with the hantavirus, or the mode of the transmission of infections of hantavirus, there are the different mode of transmissions of hantavirus to human beings. The first methods, it is the persons will get infected with an hantavirus when they inhale the aerosolize, the urines, droppings, or the saliva of the infected rodents. The second method, it is due to the inoculations of infected urines or the droppings of the infected animals in broken skin or into the mucosal membranes of eyes, nose, and mouth. The third method, It is due to the ingestions of a food and waters which has been contaminated with the urine, droppings, or the saliva of the infected rodents. The fourth mode of transmission, it is due to the bite of infected rodents. If you talk about the transmissions of Hanta virus between the one person to the another persons, between person to persons, only a few cases of, of Hanta virus transmissions from person to person has been reported in Argentina and in the Chile, but it is very less common. The Hanta virus, it causes two types of infections. That is, the first infections, it is known as the Hanta virus pulmonary syndromes. The persons will start to develop the clinical symptom after the exposures of antivirus for around 1 to 2 weeks. Sometimes it may take around the 8 weeks to show the clinical manifestation. In the early stage of the disease, the persons will develop the fever, headache, fatigue, the muscle pain, dizziness, chills, and abdominal problems such as like the abdominal ache, pain, or the diarrhea. But in the late stage of the disease, the persons will develop a dry coughing and person will feel the difficulty in the breathing, that is the shortness of breath, shortness of breathing. Eventually, if the person is not treated at the time, the person will die because of the acute respiratory failures. The second disease, it is known as a hemorrhagic fevers with the renal syndromes. The incubation period, it is around the 1 to 2 weeks after the exposure to the infectious materials, but in rare cases, they may take up to 8 weeks. At the initial stage of the disease, the person will develop a high fevers, headache, nausea, chills, blur visions, back and front, abdominal pain. In the late stage of the disease, there will be a vascular leakage, low blood pressures. The person will develop a low blood pressures, the acute cardiac shock, and acute kidney failures. The persons may develop in a serious condition. The person may develop the cardiac shock or the acute kidney failures due to a severe fluid overloaded. Again, I am going to repeat it, that during a hemorrhagic fevers with the renal syndromes, the person in the initial stage, they will develop a fever, headache, nausea, chills, the blurred visions, back and the abdominal pains. But in the late stage of the disease, the person will develop a vascular leakage, due to which there will decrease in the blood pressures. If there is a decrease in the blood pressures, what will happen? The person will undergo a cardiac shock. In a severe case of the disease, the person will develop a acute kidney failures. The treatment and the management of a Hanta virus infections, there is no any specific antiviral drugs against the Hanta virus, but ribavirin antiviral drugs can be used in the treatment of Hanta virus infections. There is no any vaccines against a Hanta virus infections, but a supportive therapy can be given along with the ribavirin antiviral drugs. The supportive therapy may be a IV drugs, that is IV fluids and electrolytes. Those persons with they feel difficult in the breathing, they can be kept in the ventilations for the artificial respirations. Those persons with the diabetes or acute kidney failures, we can do a dialysis to correct the severe fluid overloaded. Then how to prevent hantavirus infections? The prevention and the control for the hantavirus infections. There are the few methods to prevent and control the hantavirus infections. The first method it is to control the number of the populations of our rodents around our human communities. Second, it is to avoid the ingestion of a food and waters and other things which has been contaminated with the droppings, urines in the saliva of the infected animals. The third steps in the prevention and the control of hantavirus infections, it is to eliminate or minimize the contacts with the rodents in our urines, droppings, and saliva. The, the fourth steps, it is a universal steps, that is a hand washings with the soap and waters after touching with the rodents or after touching the droppings or the urines of the infected animals. If you follow this control and preventive measures, we are sure to control the infections of a hantavirus infections. I think this video will be it will be very helpful in understanding the hantavirus and its disease. Thank you for watching this video.